My talk was about the role of the workforce in choosing wisely and valuing cancer care. We know that 20 to 40% of health spending is currently wasted through inefficiency. And we know that high value care means providing the highest quality of care at the lowest cost. It's about avoiding overuse, underuse, and misuse. It's also about evidence-based care and communication between the workforce, I mean, providers and patients and their families, and among the providers themselves. So what is the role of the workforce? The workforce can increase value for money by providing evidence-based care or decrease the value for money by not providing it. And when the workforce fails to provide evidence-based care, it happens in two ways, what's known as the two gaps, the no gap and the no do gap. So we're starting with the no gap. This means lack of knowledge or familiarity with guidelines. This can be due to inadequate training, inadequate access to learning material or resources, inadequate self-directed learning and lifelong learning skills, or a lack of system level intervention and monitoring of medical competencies. The second way the workforce can fail to provide evidence-based care is being very busy with high-volume clinics, high volume of workload, teaching, administration, and regulated dual practice, inadequate quality monitoring and metrics, which is guideline concordance, lack of motivation, and outright laziness, negligence, and corruption, and inadequate training in communication, professionalism, and humanism. So how do we address these gaps in the workforce role in value in cancer care? The way to address it is by transforming health profession education. So as the WHO called for, we can do that in three ways or across three domains. One is producing adequate quantity, number of workforce, so you have enough of them so that they have time to provide adequate care and communicate with patients and their families. The second domain is quality, which is knowledge and competencies related to leadership, stewardship, and stewardship of resources. The third dimension is relevance, which means training health professionals who can function in the context for which they have been trained and who can address the health needs of their own population. How do we get that? We get there through changing the way we teach, using competency-based medical education that encompasses, in addition to medical knowledge, competencies in communication, critical thinking, ethical deliberation, and stewardship of resources. We have to invest in training program development and evaluation, and also invest in faculty development. We need to come together to share best practices in education and to harness the power of IT. Finally, I suggested in my talk, certain training strategies or experiences for steward of resources in the clinic that include teaching evidence-based medicine, addressing common diagnostic pitfalls, encouraging critical inquiry, role modeling of communication, including communication with patients on financial toxicity and wiser use of testing and therapeutic intervention, ensuring guideline concordance, encouraging incorporation of value in cancer care and cancer economics into journal clubs, tumor board, oncology society session, and recruit knowledgeable non-clinical faculty to do didactic teaching and research mentorship, and also enable research and quality assurance project in health services research, health economic research, and of course, the research that's really undervalued and not done enough is research on education. It's about how research on how we educate our workforce in order to improve the competencies, in order to innovate in teaching, and to discard what does not work and enhance what works in health profession education. We have already seen the value of such events in Choosing Wisely India. These events help galvanize oncologists locally and also allow exchange of ideas and dialogue between local oncologists and international oncology community. It brings a collective wisdom together. The recent Choosing Wisely Africa event in Senegal in December 2022, which is a collaboration between aortic and ecancer, achieved similar objectives with speakers from all over Africa. We now have a vigorous, ambitious, and engaged cadre of young oncologists and researchers coming together with seasoned oncologists to address the major question, which is how we can get the most from what we already have. thereby maximizing the benefits from our existing resources. So it's really choosing wisely to achieve best outcomes. The next step is continuing the momentum. This is now a global movement, and Africa is now a leader and an active participant rather than a passive recipient, as in other initiatives. I am hoping to see everyone engaged in the implementation and evaluation efforts of choosing wisely, currently led by Dr. Fidel Rubogumia and colleagues. In addition, I'm hoping to see the expansion of choosing wisely to include other aspects of cancer care, such as choosing wisely using labs and blood products, seeing more supportive care choosing wisely, and also more local and hospital-based choosing wisely initiatives, and definitely more research related to value in cancer care.